Hello, my name is Witold Waberski. I'm the Clinical Chief of Anesthesiology at Hartford Hospital.
What do you like most about working for IAA?
I would have to say that the partnership that I have with my fellow anesthesiologists and employees, the anesthesia providers, it is unique in the sense that we have a partnership in the true sense of the word. Every patient we care for, every interaction we have is not only collegial, professional, but it is with a sense of purpose to deliver the best anesthesia care in our community.
How would you describe the work environment at IAA?
Starting with the administrative staff that cares for all of our professional and legal needs, if you will, from ensuring credentialing, licensure, to making sure that we have educational opportunities to maintain CME. It has been a very collaborative working relationship, one that ensures that each of us are cared for, that we care for each other, and that we deliver that same philosophy to the care of our patients.
How would you describe the clinical environment?
We have clearly defined roles. We have situations where the expectations are set for what each individual team member can do and should do. And I have to tell you, in the 35 years here that I've been here, I've never been disappointed. There's always an interest in learning from one's mistakes, in learning how to coordinate the team effort as best as possible. And I will just leave it at that this is a team-oriented enterprise.
Is IAA an academic or non-academic institution?
I have to tell you honestly that I feel we have the best of both worlds. Integrated Anesthesia Associates delivers anesthesia care to many locations within central Connecticut. It is staffing an academic, a purely academic institution, University of Connecticut, as well as a large tertiary community hospital, Hartford Hospital. And between the several and variety of institutions that we provide care, there is ample opportunity for academic endeavors. And the reason I say it's the best of both worlds is I see residents in training coming through our program. And because of the tremendous volume of cases and the appropriate ratio of cases to students, I feel we're giving our best educational value here to those individuals. Many places have, I would call it, relative overcrowding of students in relationship to patients that they can learn from. Here I think we have just the right mix.
How do members become leaders at IAA?
IAA is a participatory organization. Anybody who joins this practice realizes very quickly that if you have more to offer or wish to offer more, take on more responsibilities, those are readily available to nurses as well as physician anesthesiologists. And as a result of this collaborative participatory practice, I think we have really been able to identify individuals who are interested in providing leadership, because leadership comes from within yourself. Provide that same kind of leadership for the rest of us.
What advice would you give to a new IAA member?
What advice would I give a brand new employee to our practice is I would first of all tell them it's a big place. You may feel like you can easily get lost, but believe me, you will not be neglected. People are there to support you, to watch over you. It takes a while to become familiar with all the routines and relationships that exist in a place this large. But I think after a relatively short period of time, as I've observed others who have come into our practice, the assimilation is complete. And you may have trained elsewhere and learned different techniques, and you bring those to the table when you come to practice here. But I think after a year or two, you realize that this is home, that this is where you can practice your profession to the fullest extent.